I get to counsel a lot of patients in my clinic, and I think the number one concern that our patients have when they come into the clinic and they're considering cannabis or cannabinoids as a therapeutic modality is, am I going to be able to function? Am I going to get high? I want to get better. I don't want to be on the couch. I get that enough with other medications. And my number one message that I that I tell my patients time and time again is that you don't need to get high. You don't need to get impaired in order to get a physiologic effect. And when they hear that, when they start understanding that it's not necessary to be impaired to get that effect, either pain relieving, anxiolytic, help with sleep, they are so much reassured.
On top of that, one of the most frequent things that I like to counsel patients on is storage, is housing medication. Just like many medications that we have, hence the opioid crisis,
Yeah.
These need to be out of reach, not only of guests, especially children. There's so many products out now, whether in the standard market or not standard market, that mimic so many foods for children.
Yeah.
They just don't know the difference. So really important that they really store it in a proper place.
Yeah, and going from storage, I'm sure driving and
Right.
Impairment. That's what I counsel them on. Definitely impairment. It's if it impairs you, you do not operate a vehicle. You do not operate any machinery. End of discussion. If you were to get pulled over, it's driving under the influence. What you're under the influence of doesn't really matter. And if you're impaired, you will be charged. And so, constantly educating them on, if it impairs you, do not operate a vehicle.
What about travel? You guys?
So that's a big one. I have a very large cohort of patients who are snowbirds, and we are really clear. You absolutely cannot take it outside of the country, any country. And I think that's a huge piece. And then they also, if they buy it elsewhere, they can't bring it back into Canada. That's illegal as well. And then the other thing I counsel that I'm sure others do too is to do with how do you safely get your cannabis? Where do you get it?
That's true.
I mean, another big thing in my area is there's a lot of industry. So a big question for a lot of patients is work. And my general rule of thumb is safety sensitive position. You know, you need to understand the effects it has on your body. And again, whether driving or working in a safety sensitive position, if you do feel impaired, then you can't do that. You can't do your job or you can't drive.